protuberance. This is the angle of the mandible. This is the condyle of the mandible. Okay, this is the coronoid process of the mandible, and between the two you have the notch. Okay, so the mandibular notch. This is the cheekbone, which is called the zygomatic bone. So zygomatic bone is attached here to which bone here? Temporal bone. Temporal bone. So this is the temporal bone. Temporal bone is attached to the zygomatic bone through this process, and temporal bone is attached to the parietal bone through this suture. What is that called? Squamous suture. The suture here, which connects the frontal to the parietal, is called the coronal suture or frontal suture. In the back, you have this bone called the occipital bone connected to the parietal bone through which suture? Lambdoid suture. Okay, lambdoid. And okay, let's take this. Can you? So inside the skull, you can see that there's a big hole here that is called the foramen magnum. And over here, you can see there's a big hole just on either side. That is a jugular foramen. There's many holes here. I'm not expecting you to know that. Just these two you should know. And when you look over here, this is saddle we were talking about. Okay, that saddle is called the sella turcica. That is where the pituitary gland is located. And when you go forward towards the front, you can see there is something here in the middle. This is a separate bone, and this bone is called the ethmoid bone. So what you see here is the ethmoid bone. This is from the top, and that's what you see there. So this is the little process called the crista galli or galli. So that's the crista galli, and then there's a flat area from which the crista galli rises. That flat area is called the cribriform plate, which has got a lot of holes. That's why it's like a sieve, and that's where the olfactory nerves. Olfactory nerves are the nerves for smelling. Okay, so the olfactory nerves passes through these little sieves. That's called the cribriform plate. Okay, so and the skull is this is the cranial base. This is where the brain is sitting. Over here in the anterior cranial fossa, which is this part here, that is where the frontal lobe of the brain sits. This part here is where the temporal lobe of the brain sits, and this part here is where the cerebellum sits. Okay, and those are all future things, but I'm just preparing you for that. So we had the external acoustic meatus, which is the ear, simply the ear canal. Okay, so if there is an external, there should be an internal also. So a sound goes here, goes into the middle ear, internal ear, and the nerves come out. This is the internal acoustic meatus. I'm not going to ask that in the exam, but yeah, I want you to know that there is an external and internal acoustic meatus. Okay. I think we went through most of it. Oh, looking from below, you can see that. So here you see the maxilla. Behind the maxilla, you see this bone. That's the palatine bone. And over here, you see two little spears coming out. They are the styloid process. Styloid process. That's the styloid process. What is this blunt process? Mastoid process. Okay, this is a mastoid process. This is a styloid process. What is this? These little rests here. This is where the atlas sits. They are called the occipital. This is occipital bone, occipital condyles. Yeah, this is occipital condyle. And the atlas sits there. Okay, atlas is what gives this nodding movement. Axis is what gives the rotation. The yes, no. Okay. What else? I think that's about it. So you have